There are a lot of buprenorphine medications on the market. You may be wondering what the difference between them is. Our look at buprenorphine medications is going to start with a look at opioids. A substance that binds to the mu opioid receptors in the brain and activates them is called an opioid agonist. This includes the opioids that people take for pain relief and recreationally, like morphine, heroin, Vicodin, and fentanyl. Opioid agonists create a sense of euphoria, a diminishment of pain, and a feeling of sleepiness. Some substances bind to those same mu receptors, but activate them less strongly. These are called partial opioid agonists. Buprenorphine is a partial agonist. It forms a tight bond with the mu receptors, but it doesn't fully activate them, so it doesn't create the rush of pleasure or high that full opioid agonists can. Some people do feel mild euphoria when they first begin taking buprenorphine, but most people adapt to it quickly and stop feeling any euphoria when they take their dose. Buprenorphine is prescribed to treat opioid use disorder and sometimes to manage pain. Buprenorphine is prescribed in several different versions. Suboxone is one of the most popular. It is a film that is either dissolved sublingually, which means under the tongue, or buccally, which means against the inside of the cheek. It combines buprenorphine with a small amount of naloxone. When taken as directed, the naloxone has no effect, as the body doesn't absorb it well through the mouth. But if a person swallows, snorts, or injects their medication, the naloxone will block the effects of the buprenorphine. This is included in the medication to prevent misuse. Zubsolv also contains buprenorphine and naloxone and is prescribed to treat opioid use disorder. It comes in the form of a tablet and, like Suboxone, it is dissolved under the tongue or against the cheek. There are also several generic versions of buprenorphine naloxone that are available in the form of sublingual films or tablets. Sublocade is an extended-release form of buprenorphine that is prescribed to treat opioid use disorder and is administered via once-a-month injection. It stays active in the body for that whole month. Because it is injected, it does not contain naloxone, which would block it from working. It must be administered by a medical professional. Subutex is a sublingual buprenorphine tablet that does not contain naloxone. Because naloxone is considered a safeguard against misuse, many providers will only prescribe Subutex when a person is first inducting, rather than as part of their long-term treatment. Belbuca is a buprenorphine film that is dissolved against the cheek and is prescribed for pain management. It comes in lower doses than many of the other medications mentioned in this video. It does not contain naloxone and is not prescribed to treat opioid use disorder. So, are all of these medications interchangeable? Well, despite having the same primary ingredient, some people find that one buprenorphine medication works better for them than the other versions, and some insurance plans will cover one version but not the others. You should never swap between different forms of buprenorphine or change your dose without guidance from a clinician. For more information about medication-assisted treatment for opioid use disorder, visit us online at workathealth.com.